All right, guys. So we're moving on to the next drug. This is what is known as what the Dolasetron. Dolasetron. Okay, Dolasetron. So quickly, we said that the Dolasetron is what is serotonin 5H3 receptor antagonist. So it's used primarily to what prevent nausea and vomiting, which is caused by what chemotherapy or surgery. Okay. So this Dolasetron works by what blocking serotonin receptors. So it blocks the serotonin receptors, and it mostly does this in the chemoreceptor trigger zone and the vagal afferents in the gastrointestinal tract. Okay, so when you inhibit those serotonin, the inhibition will now prevent the activation of those receptors because it's inhibiting the receptors. Serotonin will not be able to what activate those receptors again. You understand? So most of the times, this serotonin is released when a patient is undergoing chemotherapy treatment and surgery. So now it's used for treating what chemotherapy induced nausea and vomiting, post-operative nausea and vomiting. Alright. Then moderately and highly emetogenic cancer chemotherapy. Okay. So to prevent acute and delayed nausea and vomiting associated with what initial and repeated causes. Okay. So pharmacokinetics is rapidly absorbed after oral administration. Bioavailability is about 60%. Distribution is throughout the body, with a volume of distribution reaching 3.4 liters per kilogram. Metabolism is liver by the cytochrome P450 enzymes, mainly the 2D6 and the 3A4. Excretion is urine and feces. So half-life is 8 hours for oral administration, 5 to 9 for intravenous. Okay. So what are the side effects when you are taking this drug? Dolasetron, headache, constipation, diarrhea, dizziness, right? Okay. So severe side effects is QT prolongation, which is a heart rhythm disorder. It could be severe allergic reaction, serotonin syndrome if taken with serotonergic drugs. Right. So hypersensitivity is contraindicated in patients with who have known hypersensitive to this dolasetron or any component. Also severe hepatic impairment. It's also advised to caution is advised just to reduce what metabolism, right? So I think this is it. If a patient already has this prolonged QT interval, you don't use the drug, right? Because that's one of the side effects of the drugs, right? So that's it for Dolasetron.